Dr. Tina Scott Carroll is a healthcare hero because without her, the South Miami Children's Clinic would not exist. She has changed uncountable lives. Dr. Scott is a walking and talking role model. She doesn't sit in the clinic and wait for patients just to come to her. She goes to their homes, she goes to the churches, she goes to wherever the youth activities are. She's at the South Miami Community Center. She's at every event that goes on in the community. She is absolutely an integral part of that community, one of a kind and not replaceable. And she will have the gratitude of the community and Baptist Health and South Miami Hospital and all the children that live in that neighborhood forever. And we thank her.
So our entire team nominated Ruth Ann Mitchell for Healthcare Hero to recognize her more than 3 decades with Holtz Children's Hospital and Jackson Memorial Health System. Back in the 70s, child life was just beginning and Ruth Ann was completing her training, and she came to Holtz Children's over 30 years ago and has been the leader of our child life team at Holtz Children's Hospital, providing therapeutic support, psychological, social, medical support for kids. She comes to work before anyone and leaves after everyone. Our team hosts over 500 formal events every year. Child Life is about recreational and educational support for children and their families, including siblings. Often it's the parents that have the hardest time. She has to be there physically present for that child in that moment to make sure they understand what they're going to go through. Often they can even reduce the amount of pain a child experiences during procedures because of their ability to disengage the child from the medical care. And Ruth Ann has been so impressive in how she helps our kids 10 to 12 hours a day, managing children and families in their hour of need. She's truly an amazing person, an amazing professional, and an amazing leader.
Robert Meyerberg is unique. He's the world expert in the diagnostic and management of sudden cardiac death, which is a dreadful situation. There is no transition. It goes from life to death. Many human beings are experiencing sudden cardiac death every year. About 350,000. What Dr. Meyerberg has done is to learn the mechanism by which sudden cardiac death not only develops, but also how it can be prevented, and importantly, how it can be managed. Every second you are having a heartbeat, and from time to time that process is damaged, and as a consequence the tendency is for a short circuit to develop in the heart. He has identified many of these short circuits and importantly has been instrumental in helping his fellow humans be sheltered from sudden cardiac death. And for these individuals who are susceptible to sudden cardiac death, there is a treatment now. We can place an internal defibrillator for the heart. People are much safer than they used to be before the 45 years of career of Bob Meyerberg in South Florida.